One of the things that I get asked on a daily basis treating TMJ from patients that I see is often, why do other dentists not treat TMJ? Because they're often here for more of a specialist reason to come to me for TMJ therapy. And they have a routine dentist that they see for their general care. And so that question comes up often, and they're always curious why their doctor doesn't treat TMJ. And there's a couple of reasons for that, but it kind of introduces a story that I often tell. And that's my story. And that's that I had a lot of TMJ pain myself. So in my earlier years of practicing dentistry, not only did I see a lot of patients with TMJ, and I didn't know what to do for them when they had pain and discomfort and popping and clicking and headaches and the many symptoms that come along with that, I too began to experience a lot of those things. And so, of course, my curiosity was naturally piqued, living the problem, and wanted to know more about it. So as a dentist, experiencing these challenges that my patients were also experiencing, it led me to want to learn more. So through that process, my passion really developed because I was able to treat my own concerns and my own problems. And it was all through the education that I gained in order to understand my own problems, right? My own self, my own health. And so I think that for dentists to want to treat TMJ, there has to be a passion of some kind. Now, I'm a big fan of transformational dentistry, meaning that in our practice, we really lean into anything that transforms someone's life. General dentistry doesn't do a lot of transformational changes for anybody, but when you change a smile or you get somebody out of pain, you can really transform their life in an incredible way. So the satisfaction that comes with treating TMJ is a wonderful, wonderful thing as a dentist, and being able to give somebody relief from something that they've experienced for a long time or even acutely is very gratifying. But on the other hand, TMJ is a very stressful area of dentistry from a practitioner standpoint. It's one of the more frustrating and mind-puzzling parts of dentistry, and probably the hardest thing that I've learned to help with. I think for that reason, most dentists don't just dive into it willy-nilly, because there needs to be more emphasis or reason for them to want to go down that path, because it's honestly not the easiest path to be a provider in. But on the other side of that, my passion drives me to want to help others feel better like I now feel. And when the satisfaction of helping somebody through pain arrives, it's one of the more gratifying things that I get to do. And that continues to push me through the hard challenges and through the difficult cases. Because generally everybody gets relief of some magnitude. For those that get complete relief, that's always awesome. For some, 50% better is worth living and worth going through the effort for, right? And so for me, the challenge is one that I enjoy because I love to learn, I love to grow. Every patient is a learning experience for me to find some area or some angle of treatment that maybe I didn't see before, or maybe I hadn't run into before, because everybody's different. You guys are all different. So I enjoy that puzzle, for lack of a better explanation. But for me, it does stem from my own personal treatment. It stems from me finding my own causes and being able to understand the nuances in the system better of our face and the muscles of our chewing, everything that relates to it, because it is multifactorial. It certainly stretches into multi areas of the body, from the neck down and from the neck up. And so it's a challenging field, but I really, really enjoy it. And I hope that if you're experiencing the symptoms of TMJ, and if you're not familiar with those, a quick Google, of course, will provide more light on what maybe you're suffering from. The most common tend to be headaches, a lot of fatigue in the jaw muscles, neck pain, popping and clicking of the joints, ear involvement's often a component in that as well. And then there's a lot of dentitional changes, wear and grinding to the teeth, front teeth that are breaking apart and getting worn down flat. The list goes on. But if you are experiencing TMJ and you're wondering why more dentists don't treat it, it's because it's not the easiest thing to treat. However, with the predictable paths that we've created through time in dentistry, and the paths that we often use here with data and technology to help us really try to diagnose the problem, it becomes becomes an easier path to treat, or an easier problem to treat, because we have more definitive ways to diagnose, and therefore more definitive ways to also treat the case. So I hope that if you are like me and you're suffering in some way, that you won't just suffer and suffer endlessly. Give us a call. Love to meet you. Love to tell you more about my story, but more importantly, love to learn your story and to see if something we do here can help you improve your life in a transformational way. All right. See you guys later.